I'm Marianne Durand, Consultant Clinical Psychologist.
Rachel Mills, Consultant Learning Disability Nurse.
Brian Patterson, Lead Professional on the Community Learning.
So we're asked to do a session today to look at if you encounter somebody with a learning disability and or autism, the things that might be able to help you identify that and what you could do to support them within the environment that you're seeing them in. Some people that you might encounter might have a very obvious learning disability, such as Down syndrome, which is easier to identify than if somebody just has a very mild learning disability and doesn't necessarily have any physical symptoms of that learning disability, so it can be quite difficult for people to spot. But there are a couple of pointers that people can recognise in your interaction with people. I think one of the things that we need to remember is the terminology. So people might use the term learning disability, some people might use the term intellectual disability. For us as professionals, it's the same thing, it's just that language has changed over the last few years. The common language now is intellectual disability, but lots of people still use the term learning disability, so it's important to remember it's the same thing.
It's worth noting some people use the word learning difficulties to mean a learning disability informally, but as professionals we would use the word learning difficulties for specific difficulties like dyslexia, where someone has a learning need in education maybe, but not as a general difficulties of learning.
It's also really important to remember that not everybody wants to be badged as the same thing. So, for example, the autistic population don't always want to be labelled alongside somebody with a learning disability because the needs are very different.
This is one of the most obvious things, I suppose, to try to look out for is if people don't seem to understand what you're saying. And I suppose something really important to take into account is if somebody, could they need glasses or a hearing aid or something that they haven't got with them, to check that there's nothing in the way of people understanding.
One of the things that we commonly find is that people don't follow a conversation or aren't able to understand or process what's being said to them. So, for example, they might appear to sit and say, yeah, I understand that, but when you ask them questions back about the information that you've just given them or the questions that you just asked, they might not be able to follow that. So it's really important that we go back and we check that people have understood what's being asked of them or what's being said to them, whether you ask somebody to repeat back to you if they've understood that, or just to explore that a little bit further. So very often somebody with a mild learning disability can be very good at masking that. They might have grown up in a mainstream education setting and they've got used to pretending they haven't got a learning disability, or to be able to hide the fact they've got a learning disability. So very often people have really good social skills and are able to mask the fact that they are pretending to understand rather than actually understanding. So just taking the time to ask somebody if they've understood and to ask somebody to talk you through that process can be really quite helpful for somebody with a mild learning disability. Other key things to look out for are people's personal body language and their use of personal space. So it might be that something just doesn't seem quite right about somebody's interaction, whether that be that they're overusing humour or overusing inappropriate phrases or things that are just a little bit out of context. So the conversation hasn't necessarily flown in the way that it might have done with your colleagues or with other people that you might have seen that day. It's just something feels a little bit off. It's really important to explore that a little bit further because it might be again that they're masking.
I think the contextual stuff's really important. So asking people to repeat back and making sure that they're using words appropriately in context with your conversation, because that's something I find when people are masking them, they do just, yes, I agree, and then we'll go off on a little bit of a tangent. So if you bring them back, you can quite easily spot actually.
Also simple things like maybe some inappropriate humour or inappropriate use of language in that particular moment. So people making jokes that what could be classed as being an inappropriate time or out of context. People using their body language inappropriately. So sometimes people might burp and think that's funny in the middle of a context which is just out of context for everybody else.
Another thing might be that if someone struggles to tell a story in an order that makes sense, yeah, so you might, or it keeps sort of changing. If you ask further questions, that might be a clue that they struggle with communication.
So thinking about personal space, so people might not have the awareness of personal space or not be able to interact comfortably within close proximity to somebody. So thinking about somebody with a learning disability, they might be overly familiar or distant, so might not be able to spend some time in a close proximity talking that through, or might just need to go and have some space and then come back. And especially thinking about individuals with autism, they might just need a little bit of time to go away. They might find social interaction really quite difficult and might just need a little bit of time to process A, what's being said, but B, process the environment and the space that they're expected to have that communication in. So very often we find that places can be too busy, too noisy, too light, too dark, thinking about the sensory element that's going on in that particular environment, because that might not suit the person. We might need to think about how we can make some changes to that to get the best out of the person and to make sure that they feel comfortable in the environment that we're working within. So thinking about, is the environment really busy? So for example, if we're in A&E, is it really, really busy? Is it really noisy? Do you need to find somebody a quieter area to A, help establish if they've got a learning disability or autism, but also allow them some time to answer the questions that's been asked, to process what's been asked of them, so that we can get the best out of the person that we're working with at that moment in time.
And people might struggle to concentrate for a long period of time, so it might be that someone's getting very restless, fidgety, getting up and walking around, and some people struggle to wait. So it might be that waiting element that's a clue that someone's struggling as well.
And again, that sometimes is seen as dismissive. So very often when people with a mild learning disability in particular present at certain professional places, if they become dismissive and get up and walk off, some people think that's not them engaging, they don't want to engage and therefore don't want the service. In fact, they might want the service, it's just that they need short, regular breaks to be able to process what's been asked of them. And again, it's just to try and get the best out of that person. Just think, do you want 5 minutes, do you want to come back in a minute and see if that works for that person?
I think the biggest bit about that is about asking the person, asking them if the environment's right, and actually just following what they're saying, particularly with noise, light, because that impacts on people's communication hugely.
I think it's not to be afraid to ask the person. So again, how do you identify if somebody's got a learning disability or autism? You could just ask them. We could ask, do you have any additional needs that we need to be aware of? For example, do you have a learning disability? Do you have autism? And just be completely honest about that and say, we ask these questions to everybody, because that's sometimes some people just need the permission to say, actually, yes, I do, because they might not want to disclose that information freely, or they might not feel it's appropriate to disclose it freely. So sometimes just by asking the simple question, get the answer you need and can get them support that they need, rather than second guessing it.
On that note about getting more information and more context, often it's about asking somebody who knows the person well, so it could be a family member or a carer, a support worker, or even a professional that's involved, like a social worker or a learning disability team. And again, if the person gives consent to do so, they might be very happy for you to talk to that supporter to get more information and context, and that might be really helpful.
And again, if those people aren't present to be able to do that with, if we can ask the person, so simple things like, do you have a social worker? Are you open to a learning disability team? Do you need any support from your family? Do you have carers to help you? By asking those questions, it helps to prompt other questions that we can make sure we're getting that person the right support. If the answer's no to all of those things, sometimes just asking a little bit about history, so do you live on your own, or do you live with other people, or in a supported environment, or simple things like what school you went to, again, because sometimes that can give you a really good prompt or a really good indicator that person went to a special school or had their educational needs met in a specialist setting, which again can help provide us with some additional information, or again prompt those further questions as to if that person needs some support. The other thing that I think we do in professional settings is make the presumption that people can read and write, and very often people can't. People are too embarrassed to say, I can't read that, or I can't understand that. So not making that presumption. So for example, if people are in GP settings, very often now your name flashes up on a board and there's no verbal support for that. So it's, you've not got your receptionist saying, Mrs. Jones, can you go and see, Dr. Davis? It doesn't happen anymore. And again, some people with a learning disability miss those cues. So don't think to look at the board or can't recognise their name or the doctor's name on that board. So sometimes just asking the question, are you okay with written format, or do you need some support with that, just opens again the opportunity for people to say if they need any other support, whether it be pictures, whether it be somebody to verbally explain something. We can't rely on the fact that people can read and write to just get communication and to extract information from people. We need to be really mindful of that. And again, putting yourself in that position, if you're not in a position that you can read and write, that can be quite embarrassing for some people. So people, again, try and mask that so that people don't have that information about them. So just subtly asking if they need any support around written communication can be incredibly helpful.
So again, it's that first thing to do is ask somebody what kind of help they need so that you can start looking at what that person needs. It's quite simple. Can you hear me? Yeah. I have been in situations where somebody's been referred to our team because that person was deaf in one ear, they had a full meeting, she couldn't hear a word. But the police were saying, the social worker was saying, and the care agency. So she got referred to the Learning Disability Service. All she needed was for me to sit on the other side so that she could hear me properly. Quite simple.
Making sure that people have access to all their specialist equipment. For example, if people wear glasses and you're presenting them with a written document you want them to look at, have they got the glasses on? Can they read it? If they're hearing impaired, do they have any support with that? So do they have a hearing aid? Have they got it in? Just making sure that everybody's got access to what they need to be able to get the best out of that situation. If they haven't, pausing and thinking, well, how can we adapt this, or how can we overcome this? There are some times where we can't overcome that. So, for example, if somebody's come to A&E and they haven't bought the glasses or they haven't bought the hearing aid because they've come in an emergency situation, we just need to adapt. But it's just about being mindful of that and being mindful that you need to present yourself and the information that you're trying to give that person in a slightly different format so they can process and understand that. Having things written down can be quite helpful, or having things in an order. So if we're giving somebody with a learning disability, for example, lots of information that we want them to retain or a process we want them to follow, just having step-by-step instructions, so telling somebody what's going to happen in what order can really help to prepare somebody for what's about to happen. Because I think very often people are in situations that are quite overwhelming, and we're expecting people to retain a lot of information in really quite stressful environments at times. So just giving people a step-by-step go through about what's going to happen. So, for example, we're going to do this first, then we're going to do that, and then we're going to do the other. It just helps people to prepare for what's coming so nothing comes as a surprise, because we know that sometimes people with learning disability or people with autism can struggle with change or struggle with the unknown. So giving people as much information as we can in that very structured format can really help to reduce people's anxiety around the change or around what's going to be happening.
If people are struggling to wait, it might be that people could be prioritised and they could jump the queue, or they could be given information about how long the wait's going to be, or it could be like what you said about we're going to do this first and then this. You're going to have your blood test, then you're waiting the waiting room, then we're going to call you into the doctor's office or something like that. People might need breaks, so short breaks. If people are getting restless because they can't concentrate for so long because there's so much information, you might just need a break.
A break from both what we're asking them to do, but also a break from the environment. So very often somebody might just need to step outside for 10 minutes, have some fresh air, and then come back into the format that we're in. Don't assume everybody can follow the process that we expect them to. So if we're used to working in a particular order, for example, if we're in a hospital setting or a police setting and we're going through the process that we would normally take somebody through, don't presume that's okay for everybody. Sometimes some people just need a little bit more time and a little bit more care and attention to be able to get the best out of somebody so that they can reach their potential in that particular environment.
You might need to repeat yourself several times over the course of your encounter, because someone may have forgotten what you've already said is going to happen.
I think it's about preempting it. Very often you can put people in some very stressful environments so people aren't retaining all of that information. So that, as you say, they might need those verbal prompts several times to be able to process what you're asking them to do or what's expected of them, and so that they can follow that request. When you're working with somebody, making sure that you're thinking about reasonable adjustments. So how can I help to get the best out of this person within this environment? And as you say, Marianne, that might be about changing the environment or changing our offer slightly.
And yeah, so the other thing is, it's just being nice, because it's nice to be nice.
I completely agree, Brian. It's our responsibility to get the best out of people and to make their experience as easy as it possibly can be, to reduce any anxiety they might have, and to make sure that we've put in place the right systems or reasonable adjustments for people to enable them to engage with us. I think sometimes we forget, we're so stuck in a process that we forget that it's not their responsibility always. It's our responsibility to communicate effectively. It's our responsibility to get the best out of people. And as professionals, or as people who we might encounter, we have a duty to get the best out of people by changing our approach and adapting our approach to marry into what the person might need.
I suppose it's worth having in the back of our minds if somebody's getting quite distressed in wherever you are, or getting anxious or frustrated, that we might be struggling actually with that environment, and they may not have a learning disability, they may be autistic, and somebody, so you might think they're understanding everything, but they still can't cope with that environment, and they might need adjustments to help them to cope.
I think that's an important point, actually, Marianne, that if somebody is in distress, or if somebody is presented in a way that you don't understand is typical for somebody within that environment, it's about maybe thinking, maybe they're not actually being difficult, maybe this is a behaviour that they're trying to communicate something else to you, and thinking about what that something is, or something that we've missed. So if somebody is in distress, thinking about how can we make this better for somebody, or how can we adjust what we're doing to reduce that distress to somebody.
Yeah, so it's not thinking if somebody's doing something which we wouldn't class as the norm, just taking a step back and thinking, well, why aren't we doing that? Because it is generally a communication that we've missed first off.
People might have brought somebody with them that they are happy to have talking to you, if someone gives their permission. It might be family members, might be a partner, might be a support worker, or might be a professional like a social worker, or even community learning disability team.
It's really important that you ask the person if they're okay with you speaking to that person. Some people it's okay, some people not so much, so it's really important that we get their consent where it's appropriate to do that. Where it's not appropriate to do that, obviously there's a best interest process that professionals working with that person would follow. I think that it's really important that we listen to the person that we're working with, but as importantly their family and loved ones. If they are giving you some information that they think might be helpful, they're doing that to help you to get the best out of that person. So, for example, if somebody said, actually, Joe blogs might need a quiet space, or you're using too much language, or they need a little bit of a break, take that as read, and try and support that where possible, because that will get the best out of the person. So not making the presumption that we know best in the environment. Actually, the families and loved ones at that point probably know their loved ones best and know what will support them in that process.
So in summary, the 3 top tips that we think you need to take away are: ask the question, listen to the answers and use the answers, and it's nice to be nice.
So all of the suggestions that we've made today would be relevant to somebody if they had a learning disability, or if somebody was autistic, because it's about making sure that person feels comfortable within their environment and trying to reduce that distress to the person. So regardless of your diagnosis, that would be helpful.